Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the channel today. I saw a patient this morning that made me just want to jump on and create this video. And the topic is what is going to be called, what's the deal with uppers and downers? Now, I've heard this phrase before from multiple sources: doctors, therapists, patients, law enforcement, state that I work in. The concern that there are medicines that are uppers and medicines that are downers, and the idea that certain patients, if you're given those, well, you're creating a problem for them. Now, I'll be the first to admit that there are people that abuse medicines that I use. There are people that abuse Adderall. There's people that abuse Vyvanse, other medicines that you would call stimulants that I would call norepinephrine boosters. I'm also the first to admit that there are patients who will abuse benzodiazepines. So the medicines that have names like Xanax and Valium and Ativan and Klonopin. But what we're not talking about here is abuse. We're talking about patients that benefit and need these medicines medically, and what happens when they can't get them. So the story today is a woman who, she's going to know who she is immediately when I tell the story. Obviously, we don't identify patients on these videos, but she had basically been doing completely fine on a combination of Adderall, which is a norepinephrine booster, and lorazepam, which is a GABA booster. Even though people call it a benzodiazepine as a class, it boosts GABA. And if you don't know what I'm talking about, go back and watch some more of these videos because they're there to teach you. But she had been on this program for basically about 20 years and had no problems whatsoever. Never took more than she should, never lost her medicine, misplaced her medicine, never had a problem with taking too much medicine. In fact, she's on basically extremely low doses of both medicines. But her previous doctor, after practicing for years and years, either retired or moved or something happened, and so she got a new one. And the new doctor said, I'm not going to give you uppers and downers. If you're going to take uppers and downers, you're going to have to go elsewhere. I suggest you go see Dr. Holmes. So she shows up in my office being basically treated like, and being told that she's taken a bad combination of medicines, uppers and downers. So I just want to explain what I said to her. And at the end of it, she left, I think, feeling very positive and very relieved that she's not some type of drug abusing criminal, because the only evidence that we have of her ever having a problem with is nothing, zero. So the idea that the implication that she's taken two kinds of medicine in these two classes makes her a problem patient is just a false idea. And as I do on this channel, I preach that this is a medical procedure, and if medications help you, as long as you're taking them correctly in the right amount, as prescribed by me or whoever's taking care of you, as long as you're within the guardrails of what you should be doing, my medicines in themselves don't make you a drug addict. My medicines make you someone who just feels better on those medications. So I used to draw pictures. For those of you who no longer watch the videos but listen to these as they're a podcast, I've started talking with my hands, using my left hand as the normal range of where you should be, and above or below that normal range is how I talk. So that's what I'm going to talk about now. So she is on a serotonin booster, so that's really not part of the important discussion here, but she's taken a serotonin booster. So the deal is, if you're low on serotonin and you have the symptoms of depressed mood, low interest, low energy, hopeless, helpless, can't concentrate, sometimes having thoughts of being rather be dead than be alive, that's the basic picture of low serotonin. I'm not sure that she had all that, but certainly she benefited from this medicine. So historically, 20 years ago, whatever she had, she is fixed by taking a serotonin booster. That's not the medicine we're talking about. We're talking about the other two. Norepinephrine. Covered this before in previous videos. If you're low on norepinephrine, I show the normal range, my hand is below the low line to talk about shortage of norepinephrine activity. As best we understand it, that is what causes the symptoms of attention deficit disorder. We believe that because medicines that boost serotonin, that push your low levels of I misspoke there, sorry, your low levels of norepinephrine, talking about norepinephrine here. If you're low on norepinephrine, medicines like Adderall, Vyvanse, dextroamphetamine, Ritalin, Concerta, Those names, those medicines boost norepinephrine to get you to the normal range. This particular woman, low dose of Adderall, takes her from here, low, to here, normal. What does it do for her? It takes her from being sort of scattered, can't concentrate, can't focus, can't pay attention, to normal. Okay? The third medicine she's taking is lorazepam. So lorazepam, obviously we're talking about GABA. If you haven't watched the GABA videos, watch the GABA videos. If you're low on gamma aminobutyric acid, we call that GABA. If you're low on GABA, we believe that's what causes panic attacks and anxiety. The reason we believe that is that medicines that boost GABA, the medicines that are called the benzodiazepines, the GABA boosters like lorazepam, alprazolam, clonazepam, diazepam, so those are the generic names for, what order did I say them in? Ativan, Xanax, Klonopin. You can rewind and see what I just said there. The point is that though those medicines, Xanax, Ativan, Klonopin, Valium, those are the big four that we use as GABA boosters. Even though they're called benzodiazepines, they don't know that they're called that. All they know to do is to raise your GABA. So she's taking 1 milligram of lorazepam per day. 1. And again, the guardrail, you can watch other videos, but the guardrail is you don't want to take more than 4 milligrams a day, pretty much ever. But if you take more than 4 milligrams a day for more than 3 months, that's how you get into the tolerance and dependence, which are the hallmarks of addiction. So really the guardrail is don't go beyond 4 milligrams. And this woman has been taking 1 milligram for 20 years. So 10 milligrams, basically starting or maybe even a little less than a starting dose of Adderall, and 1 milligram of lorazepam. And the new primary care doctor and the person take care of, the nurse that was in that office, she basically said, made her feel like a drug seeker, made her feel like a drug addict, and did use the phrase, I'm not going to give you uppers and downers. So, what do uppers and downers really mean? Now, I covered this in an early video, but I'm just going to explain it again. If your normal range of norepinephrine, talking about norepinephrine first, if that's how you feel normal, and you don't have that, if you're low and you get your norepinephrine pushed up with a medicine like Adderall, well, then you go to feeling normal. What happens if you start with normal norepinephrine and you take Adderall to push it too high, to go beyond normal? What are the symptoms of that? Well, you feel stimulated. That's where the term psychostimulant comes from back when decades ago when these medicines were first being developed. When you give them to a person with normal norepinephrine, guess what happens? They feel amped. They feel buzzy, powerful, thoughts race. I can do more than I normally can do, as if, high. That's why some people call them uppers, and that's why people who abuse them should not be taking them or call them uppers, because it's similar in fashion to cocaine or methamphetamine or whatever stimulant the people that should not be taking the drugs of abuse should not be taking. That's how they describe them. They are uppers. This is for people that should not be on them in the first place. So that is a language of people that are abusing the medication and shouldn't even be on it. Okay, so that's the language of upper that was presented to my new patient. How about downers? What are downers? Well, okay, let's talk about GABA. If you have low GABA, so your GABA is below normal, and that's causing panic and anxiety, and you take Ativan, and that fixes you. Well, it doesn't fix you because it knows that you have panic. It fixes you because it boosts your GABA. So GABA boosters get you back to normal. So you feel normal. People that take GABA boosters, they just feel normal instead of feeling anxious and panicky all the time. So how does that become a downer? Well, what happens when you start with a normal GABA level in your brain, normal GABA activity? Say you're completely normal in terms of GABA. Without a blood test or x-ray, we don't know if it is true, but we do know that when people who don't have panic and anxiety and they take a GABA booster and it boosts their GABA above normal, how do they feel? Well, they feel stoned. They feel drunk. Actually, patients say to me, it's sort of like drinking a couple of martinis, but I don't feel hungover the next day, which is how it becomes abusable, that people are able to use it instead of alcohol without having the sort of the negative consequence the next day. So people that are using Xanax and Ativan and Valium and Klonopin to feel impaired, they shouldn't be on the medicine in the first place. So this is exactly the same situation with the Adderall. If you're not supposed to be taking it, you're not supposed to be taking it. So a person that has normal, they take Valium or Ativan when they shouldn't, and they feel stoned, intoxicated, chill, zonked. That language is about people who feel that the medicine are downers. Okay? So we just described uppers, norepinephrine boosters, and downers, GABA boosters. Well, first of all, is there any conflict with taking a norepinephrine booster and a GABA booster if you're taking two separate medicines in two different systems? No. I've taught that a lot. If you're working in the brain chemistry field, taking two different medicines for two different systems is completely normal. It's like treating blood pressure with a medicine that treats the amount of volume you have in your body, and also treating the control of the pressure in the vessels that you have. Preload, afterload, that type of stuff. So there's no problem at all with taking two different type of medicines. Now, you don't want to take two medicines of the same kind in either way, but taking two different medicines at one time is no big deal. And a person that needs norepinephrine boosting and is taking a medicine like Adderall, a norepinephrine booster, and at the same time needs GABA boosting, well, guess what? You can take them both. And that doesn't make them an upper or a downer, or upper and downer. That just means they're getting medicines that are beneficial. This is like wearing glasses, and you have one lens with one prescription in one eye, and the other lens has a prescription for the other eye. There's just no big deal about it. The language of uppers and downers applies only to the people that shouldn't be taking the medicine in the first place. The person that takes the Adderall to feel high, to get the up, shouldn't be on it in the first place. The person that takes the GABA booster, the Ativan, or the Xanax, or the Valium to feel stoned, shouldn't be on the GABA booster in the first place. So the language of uppers and downers only applies to the people that should not be taking them, which by definition means abusing them. Taking a medication, especially a controlled substance, without a legitimate medical reason is abuse. That's a crime. They shouldn't be doing it. And there's no question about that. The only problem that I have is, why are you taking the patients that need it and throwing them into the same basket as the people who are abusing the medicine? Why are you doing that? Well, you either don't know, so I'm here to teach you, or you don't care. And you don't care, that's really bad. If you're a prescribing person, a physician, or somebody else who writes prescriptions, and you don't care, that's a bad thing. And also, if you're a pharmacist and you don't care, you just see a prescription for Xanax and Adderall and say, oh, that's bad, that's uppers and downers, you shouldn't be on those. If you really think that, you either don't know or you just don't care to know. So that's why we have a channel here. That's why I'm talking here. I've been doing this for 30 years, trying to convince people that this is a common sense way to take care of folks. What I know from 30 years of doing it is it's the right way to handle it. And so if you're in a situation where somebody's accusing you of being on uppers and downers because you're taking these two medicines, well, first ask yourself, should you be taking them in the first place? Okay? If the answer is no, then maybe they're right. You shouldn't be taking them. But if you were taking them for the right reasons, that they help you, that you don't abuse them, you're not taking too much, you're not selling them, you're not giving them to your family and friends, you're not hosting parties with bowls of pills. You know, if you're not doing any of that stuff, if you're simply taking a medication in the proper dose and under the direction of somebody who knows what they're doing, you're not doing anything except just trying to get good medical care. So if you're that person that's not abusing the medicines, you need to defend yourself. And if somebody starts giving you a bad time about uppers and downers, well, first of all, I think you need to absorb and digest this information so that you feel confident that you can talk back to them. And if they care about you, or if you think that they'll listen, show them this video. Because really, fundamentally, as soon as someone is not wanting to treat you, or they're treating you poorly, or profiling you because of their idea about medication, well, again, if you're abusing the medicine and you shouldn't be on it, then that's on you. But if you're taking it for the right reasons and the right way, and they're giving you a bad time, but because of their bias, that's on them. Okay? So that's what I have to say about uppers and downers. Hope the information is helpful to you. And appreciate you coming to the channel today. Thanks for coming to see me. I'm Dr. Dave. We'll see you again soon.